The purpose of the Healthcare Forum is to facilitate a dialogue among healthcare leaders focused on EMR adoption. We've assembled some of the most influential healthcare leaders today in order to address the new leadership agenda that's necessary for improved outcomes and sustained EMR adoption. We're lucky enough to have some of those folks sharing their perspectives on the critical issues.
EMR adoption really requires a teamwork approach between information technology specialists and physicians. There are some people that wonder whether it should start in IT and end up with physicians, but in reality it should ideally start with physicians, and physicians should take ownership of this project from the beginning, with IT serving as more of a consultant sort of a role. Now, practically, many of these systems are started and initiated as projects from the hospital side without the physicians involved. And so we have a problem where sometimes the physicians are late in the game to take ownership of the project. Barriers to ownership can be numerous and include physician behavior. Certain physicians have really had a culture of being independent and untrustworthy of others and not being team players very much by design and by training. That culture is shifting, but that's one significant barrier that we have to overcome. Another barrier that we have to overcome is just simply time and getting physician leadership and physician involvement. I think there are many areas where physician leadership has been outstanding, but there are also many areas where it's significantly wanting. And so that's also a significant challenge. Communication is also always an issue with physicians. You have limited time, and it seems like there's no good way to communicate with them. And so trying multiple different ways to communicate with them is very important. Getting what we call, really, I think, buy-in more so than ownership. Do they really own this process, and can we get them to set expectations that are reasonable so that they can continue to work moving forward to build a better product? One strategy for improving physician buy-in and adoption is to find your biggest naysayers and try to convert them. And that was the case when we went to what we call the second phase of our EMR implementation. We were doing computerized physician order entry. This was something that touched it right at the heart of what the physician does. I had some people looking at this change in the way you order and saying, I can't do this, this is too complicated. And some people said, well, this isn't my job to order things, somebody else is supposed to do that for me. And I pushed back pretty hard on that. I said, geez, you're a physician. This is core to what you do. One of the biggest naysayers was an older physician that worked in my same practice group who said, there's just no time to do this and this is too complicated. We can't do this. Well, I also knew something else about him, that he was kind of the leader of the group, and if he bought into this, that others would follow. The other thing I knew about him is he had been complaining for years about how he never got any of his test results back. We used to get them back on paper, and you'd get about 50% of your test results back as a piece of paper in your box. The other 50% would either go to one of your colleagues by accident or would get lost somewhere. You just didn't expect that you ever got your test results. This was his biggest complaint. Yet he wasn't really linking the two. So the first thing I did is I brought him into a group that was working on how to build order, and we already had gone so far as to simulate in a test environment what ordering would look like. And when I first showed it to him, he says, there's no way we're going to do this. And I said, well, sit down, enter in orders, just pretend you have a normal new patient and enter in the orders you would for that patient. And he sat there, and like the whole group essentially looked at him enter orders in. And he did this all with little training. He was pretty slow at it, but did a lot better than we thought. And at the end of it, he said, guys, this is easy. We can do this. This is not hard. It turns out this is really pretty easy. And then that really got the rest of the group to go along board. But where we really sealed the deal is several weeks after we implemented CPOE, there were a lot of growing pains and a lot of how do I find that thing that used to be on that paper. And he was one of them. But he said, Dave, I will gladly put up with the I can't find my thing, and I used to order on a piece of paper and now it's in the computer and I can't see very well, and I'll put up with all that because every single one of my test results, 100% of them, I'm getting back as soon as it's done. Nothing's being missed. And as a physician, my biggest anxiety was that I was going to have an abnormal test that I wouldn't even know about. And now I'm getting that back. And so we were able to get him really to buy in quite heavily. He still has complaints, of course, as we all do. But he had two things. First of all, this was not as hard as he thought. And the second issue was, oh my God, I finally got my test results back, and they didn't go to the wrong doctor, and they didn't get lost. I'm starting to see how this could be helpful to me. I believe both physicians and IT should own implementation of an EMR. Ideally, this should be done from the very beginning, with physician buy-in in terms of vendor selection, in terms of the design of the implementation, and even the design of the EMR itself. The physicians should feel like this is the house that they designed and built. This is their custom house. They're going to live in it. They need to build it. And that's really the ideal situation. Unfortunately, in many cases, it doesn't quite work that way. Sometimes for very practical reasons, administration, hospital staff are really driving this project to initiate it. Oftentimes it doesn't start with physicians. But physicians being really the most important key stakeholder, if they aren't on board at the very beginning, they need to catch up and take ownership of it. It's more challenging to take ownership after you have IT drive the implementation from the beginning, but it's an essential part of this. So if you had the time and the money and the foresight to get physicians involved from the very beginning, that's the greatest way to get into optimizing ownership, physician buy-in, and have a more successful implementation. Some of the barriers to a collaborative approach between physicians and IT to implementing and adopting an EMR would even include physician cultural issues. Physicians have been trained to be independent. Physicians have been trained to be essentially the heroic figure that comes in and saves the day using just their knowledge and their expertise. And the analogy today put forward was that of an airline pilot who's highly trained and who's in charge and who is solely responsible for the lives of the people on this plane. Unfortunately, a lot of physicians haven't gotten clued into the idea that a more successful strategy in modern medicine is a collaborative or teamwork approach, that the physician in working with a team of healthcare providers becomes much stronger than any physician could by itself. And so the team approach always kind of trumps the individual, but it's difficult to really get physicians to transition to that kind of thought. And really, an EMR demands or requires a physician to have the approach of, I'm working as part of a team. And if a physician does not have the approach of, I'm working as part of a team, I'm working by myself, not only does an EMR system have less value and you get less buy-in, but implementation is not going to be very successful. One of the benefits of getting physician buy-in during an EMR implementation is that you get a higher quality system. The system's only as good as how it can match the physician workflow and the physician needs. So one of the concerns about EMR implementations is that they may or may not improve quality. And a lot of us believe that the difference between an EMR improving quality, saving costs, improving patient care, or doing detrimental things to cost or patient care or quality is really adequate physician adoption. Does the EMR workflow match the physician workflow? Does the EMR resources match the physician's need and meet those needs? And only through a collaborative effort and only with physician buy-in does a physician help to not just initiate this EMR process, but mold it and build it over time to become more appropriate and to better meet their needs. Unfortunately, many times physicians don't own the project from the beginning for various reasons, and when they don't own the project from the beginning, it can be difficult to catch up. If physicians aren't truly feeling that they own the project, they're less invested, they're not as willing to spend the time, and maybe more importantly, they're not giving the feedback to the design and modification of the project over time. And so then you have a greater and greater mismatch of the technology or the EMR or the project or the workflow to what the physician's needs truly are. And if you don't turn that around, you actually get an increasing chasm between the project and the actual physician.
One of the ways that we've been able to alter physician engagement is through the use of research studies. For example, when we were first going live with our patient portal, and one of the studies we were doing was to show patients their test results in real time. And we said, well, you know, there's lots of stories and anecdotes about, or theories about how this is probably a bad idea. You know, you show the patient their test result and they will call us with hundreds of phone calls. You know, that potassium from 3 years ago was slightly abnormal. How come you didn't tell me about it? CT, I want to take care of patients, not answer nuisance phone calls. And on the other hand, we have physicians who understand that more transparency is a good thing. We already release our records to the patient. Why not make it more convenient and they can be a collaborator in our care? So we actually conducted a research study where we randomized half of our patients to full access electronically to patient test results in real time. The moment that the physician got the test result, the patient would receive it at home. And of the 7 physicians we approached to do this study, 3 of them were in favor, 4 of them were against. And in fact, one physician said, you know, the only reason I'm going to participate in your study is because it looks like you're doing a rigorous study, and by the end of the year you will know precisely how bad an idea this is. Well, we actually measured those results, and at the end of the year went back and spoke to these physicians. And surprise of surprises, turns out all 7 physicians at the end of the study were in favor of transparency and immediate release of test results. One of them said, I didn't know this was still going on. I had no impact to my workflow. The nurses loved it. And they said that patients called with much more intelligent questions than before. Instead of saying, what's my ejection fraction, they were saying, well, I see that my ejection fraction fell. How can you help me get the number back up? And one patient said, I traveled out of town. And usually when I lose luggage with my medications, it's a bear to try to get those pills refilled. I was able to go to an urgent care in the state I was in and say, if you have Internet Explorer, I can show you my chart, and please could I have my prescriptions refilled because I'm out. And that worked tremendously well. And at the end of the study, physicians actually said, you know, having patients have access, and this is actually the same physician who was dead set against this in the beginning, said to us at the end, you know, having patients have access to their chart, I think is fundamentally the right thing to do and makes me a better doctor. And all of our jaws dropped at that moment. But this person has been one of our biggest supporters since then. So one of the issues we struggled with was IT ownership. So often hospitals take the initiative to institute an electronic health record, and yet oftentimes the physician leadership is not ready. And we're faced with playing catch-up sometimes. And why is that? We tried to look at the fundamental reasons why clinicians are not necessarily on the forefront of wanting to adopt electronic health records. And one of the main reasons is many of our physician senior leadership are not typing savvy. They never took it in high school. They consider it a secretarial activity. And so consequently they look at the IT leadership and say, so you're forcing me to be a secretary instead of paying me to be the clinician that I am. It's a big barrier that we have to overcome. One of the ways we get over that is by saying, you know, this is really the way that we take your information and translate it to action. Do you want to play the game of telephone and say, I said this, and the next person said this about my order, and the next person said this about my order, and ultimately they get the order wrong. Whereas when I enter it, I can see that I got the order right. I get the alerts from the computer. I respond to it personally, and over time that's more accurate and safer care for the patient.